Today we have Lynn Kohan, and I just wanted to welcome you to the Pain Exam Podcast. How are you, Lynn?
Great. Thank you so much for having me.
And Lynn is podcasting from her home, correct?
Correct.
Okay, so how are you guys managing during the COVID crisis? By the way, Lynn is the program director at University of Virginia, and she's very active in multiple different academic organizations such as ASRA, APBD, SAA, and ASIP. And how you doing, Lynn?
So obviously, COVID, I think was something that none of us would have anticipated, and it came on very quickly. So we had to make rapid changes quickly. For fellowships, obviously, it was a huge impact. Our fellows prior, were doing procedures and seeing clinic patients and doing surgeries, and all that came to a abrupt halt once COVID hit. So definitely severely impacting their training. Fellows were definitely worried about, the long-term consequences of that.
Are they being pulled to do anesthesia cases or at least anesthesia duties, I should say?
Yeah, and so we are lucky in that we are in what's called stage 2. So the ACGME has developed like stages kind of based on the severity of COVID in our area. So unlike you guys in New York, where you were severely impacted, unfortunately, we are not so bad. And so while they made a lot of plans for redeployment and they asked for volunteers for redeployment, and I got a lot of emails from GME, about potential redeployment, none of our fellows ended up being redeployed. And so they were not pulled to anesthesia duties or kind of basic COVID related care. In our fellowship, because not all of our fellows are actually even anesthesia based, we do, accept on purpose, multi-specialties. And so, but none of them were redeployed.
How big is your program?
6 fellows.
6 fellows.
Yeah. But we rapidly evolved, to the initiate telemedicine. And so
sure.
We involved the fellows in that actively. They were able to, we used a platform that was able to allow the fellows to initiate the call with the patient, and then they were able to bring us into the same room with them when it was time for us to talk to the patient. And so it really kind of acted like an actual clinic room.
Wow.
They were able to to speak to us privately, to present the patient, and then bring the patient back in to have the 3-way conversation. And sometimes our scribes even were in the room too. And so we were all at our homes, doing this virtually.
Crazy times. And I guess, are you doing any injections at all, or just a few, or?
So during that whole time, we were still doing our intrathecal pump refills. And initially what we tried to do is kind of bring a month's worth in, like in 1 week, like kind of right before it was hitting. But then we still were seeing those doing pump refills the whole time. And just this week, we started coming up for injections.
I see.
And so I definitely know, like talking to other program directors, I think this is varying around the country in terms of how people are coming back up. Where we are, we're not, the university is not testing patients prior to procedures. So we're using some of the guidelines that have been put out about how to kind of safely come back up in terms of stratifying patients based by age or medical comorbidities. And so this is our first week back to doing procedures.
Nice.
We're going to continue to ramp up as we can, trying to maintain the social distancing as well.
Sure. And you and I talked earlier this week as we were involved in a manuscript that's going to be published in June. And you do a lot of work. I randomly look up articles for my Pain Exam podcast for questions, and I see your name a lot. You're really doing a lot of work. And even before we ever met, I've heard of you, and I always wanted to talk to you. And I'm finally happy that this COVID crisis pushed me to kind of expand my repertoire and get into the Zoom, so I could now do these video casts a lot easier. And that's the reason why I probably didn't have you on sooner. But I guess you're really involved in publishing, and I just wanted to I guess, to hear about some of the work you've done, and you have things cooking. If you want to just shed a little light on what you've done with ASRA and your papers on genicular nerve blocks and whatnot.
Right, right. It's all exciting. I enjoy this aspect. It's probably, why I'm in academics. And it's wonderful to be able to, to have that information get out there for everyone. And it's also a learning process, for the author during it as well. But yeah, we started, with, we do a lot of the kind of joint extremity RF. And, kind of going back to 2014, I kind of wrote a small abstract for ASRA. And, from there kind of grew in terms of some of the literature on genicular nerve blocks, try to highlight that in the ASRA News. I just finished, I was a committee member for ASRA News, and then was the associate editor for the chronic pain side. And my term on that just ended. But it was nice to be able to highlight other people's work that way too, and kind of, highlight different articles that members would be interested in.
Sure.
In terms of that, and definitely, interested in mentoring and education. I'm very, excited to be part of the new SIG that was just formed in ASRA by one of my colleagues on mentorship and leadership within ASRA. And there's lots of good opportunities, and also really excited to be chairing a multidisciplinary or multi-society group that ASRA is leading, but it's ASRA, ASA, AAPM, many other societies on buprenorphine. And so we just formed an ad hoc committee to try to come out with some advice for anesthesiologists on buprenorphine use throughout all different aspects of pain. So we're working diligently on that, and hopefully we'll have some stuff out on the fall for that.
That's great. And you just published recently about the COVID, correct?
Correct. So
You want to tell us a little bit about that?
Yeah, ASRA had asked actually for some, they're hoping to get some information out on COVID. So it kind of started by putting together an infographic about that. And, my focus was kind of, that I offered was on pain fellowships and the impact of COVID on pain fellowships. And from there, we were having a meeting with the pain program directors, and we thought this would be a nice way to kind of get that information out to them. And that subsequently evolved into the two-part manuscript. So we just wanted to really provide a way for everyone to understand the different impacts of COVID on pain fellowships, from the changes in the ACGME policy, the changes in education and the ABA. In terms of education, we've shifted everything to Zoom and, Google Meet and all these different educational platforms where we used to have lectures in person or journal clubs in person. And it's also really opened up the door to have like institutional
Sure.
lectures, which we couldn't really have before, because obviously everyone couldn't just come at 12 noon to, Charlottesville, Virginia.
Right.
And it really, opened up that pathway as well. And then the manuscript also, as I mentioned, the ABA and the impact on the oral boards for those that are anesthesiologists, and the unfortunate impact of the pain exam being the same day as the part 2, the PMNR exam.
Wow.
And as pain program directors, we did send out a letter to the society to try to see if there's any way that we can impact and change that.
Sure.
But then on, telemedicine and fellow wellness, kind of all the things that might impact fellows during this.
Yeah, speaking of the fellows, what about the jobs? Did people like neg on their promises and contracts to hire people, or are you seeing that sort of thing going on?
So, I mean, it's been a big concern. We've been lucky that most of our fellows kind of had some contracts in place prior to that time. But there are some, that, a lot of places, they were kind of in the negotiating phase, and, the financial impact on private practice, is big. And I think it is something that definitely has impacted fellows. Some of our fellows were told, that, we can try, to have you sent on, but the reality is if this goes on for longer, we might have to furlough you.
Yeah.
So almost even before they even start. And I think the hard part about it too is I think that impact is going to be becoming more and more prevalent because as the collections, when COVID started in the beginning phases of COVID, private practices were still getting their collections from the work they did, 2-3 months ago.
Right.
But I think it's going to become more and more apparent the financial impact, the next few months when the collections aren't coming in. And I wonder now if we're going to see even a greater impact on some of those jobs.
Yeah, I think you nailed it. That's really what's going on in a lot of practices, and from a lot of people I talk to. My physical therapist, I mean, physical therapy also, like dentistry, those fields, at least we're not really working in people's mouths, I guess.
Well, one of my colleagues, her husband is an oral surgeon, and so he's in the mouth now. I mean, they closed, but they're back up and going, and there's everyone's it's very busy, and he's in the mouth all the time.
Right. Now people are scared.
Yeah, and that's as we're coming back up, that is something to think about the PPE and fellows and making sure that they're safe.
Right. And a lot of our conferences are going to be postponed, and hopefully in the fall they'll happen. But people, unfortunately, their finances are not going to be the same as they were a year ago.
I know.
And then people have the apprehension and fear factor.
Mm-hmm.
Are there going to be enough flights available? I mean, it's like never ending.
And flights, I mean, so we're getting information in terms of potentially our fellows coming in or new trainees coming into the institution that, if they take a flight because that's not social distancing per se, that they might be furloughed for 2 weeks.
Yeah.
So when they're starting training, and so we're as programs like, okay, are we going to have our trainees for the first 2 weeks or are we not?
Wow.
So for instance, if they're coming from New York too, they might be furloughed and not start their year for 2 weeks.
You mean quarantined for 2 weeks or furloughed?
Yeah, sorry, quarantined.
Quarantined, wow.
Yeah.
Well, at least they could do Zoom, I guess, orientation and whatnot.
Yeah.
It's a crazy world. And what I've noticed is I think the organizations, people like myself, maybe Paincast and any of these online Aspen, all these people who are doing webinars, it's I'm starting to see people pulling their resources together.
Yeah.
And we're trying to kind of figure out ways to just ride the wave because it just completely, if you would have asked me a couple of years ago, what would have shut down New York, I wouldn't have said this. Dirty bomb or this or that. I never would have thought this.
I know. It's very true. But it's interesting in terms of what you do in the webinars, because I think this time has highlighted the importance of those. You were already doing it, but a lot of other people are starting to do it now, and it's going to be definitely, I think, continuing into the future. I mean, if you'd have to try a silver lining out of COVID, I mean, it's the use of these types of educational materials and how invaluable they really are.
That's right.
You were ahead of the curve, so.
Thanks. Always trying. So I guess I'm going to start to wrap it up soon because I have to get to my next appointment. But I wanted to just, you have your platform right now. You have doctors across the country listening to you. The pain community is listening or maybe watching. And you're a big voice in education and academia. And is there any closing words or advice or any words of hope and inspiration you could lay on us? Sorry to put you on the spot.
I think, just, one of the things I always say about being in pain is how lucky we are to have people and colleagues who are so supportive of each other. And, it's how nice it is to do collaborative work. It's wonderful to be doing this, upcoming paper with you and the opportunities to work with people all over the country. And I think we just need to continue to stick together and support each other through this and in the future. We're lucky to be in a field that we have those opportunities and the people we have within the pain field.
I agree with you. And I'm an optimist, glass is half full. So as long as, everybody stays healthy in your family and friends, just ride the wave and just, try to make the best of it.
Yeah, because I don't know how long this will continue for, right? I don't think it's going away anytime soon, but it's true. I just, hopefully everyone stays healthy and well.
Great. And I want to thank you for joining us, and stay healthy.
Thank you.